Mental hospital workers of Reddit. What's the craziest thing you've ever seen on the job? I did my internship at a state mental hospital about 11 years ago. There was a guy there who spoke mostly Spanish and was known for exposing himself to various women throughout the campus. He wasn't on my caseload, but he came to plenty of my groups and was polite to me and well behaved. My last day at the hospital, he walks up to me and hands me a crumbled brown paper bag and says he got something for me in his broken English. I was terrified to look inside, knowing his reputation and his violent history, but I peeked in and was shocked to see a small pink teddy bear. I still have it. He shoved the bear down his pants before giving it to you. I guarantee it. I didn't technically work there. It was a clinical rotation for school, but I have a couple stories. So this paranoid patient, who was relatively pleasant, told us that there was a bat in her room. This was an inpatient facility. Patients don't typically go outside, and windows don't open easily. She was brushed off. One day during rounds, she repeats that things are going well, but there's a bat in her room. She caught it. Everyone was doubtful, but sure enough, she pulls down her bed sheets and there's a goddamn bat trapped underneath that flies out. Felt real bad that people wrote her off for that. So now I'm very careful with people who claim to have seen or felt things that seem unlikely. I've encountered, and had to help catch, a bat that somehow appeared in an apartment that had been locked up for months. I feel for this woman. Bats are sneaky as frick. My wife works in a psych ward and she had a lady recently give birth to tea bags after claiming to be pregnant during her stay. She shoved them up there and acted out a whole birth and everything. When that was all said and done, she spent a few days screaming at the nurses and techs to give her the baby back. She went to a long-term treatment center after that. While I was doing clinicals, nothing terribly exciting happened, because we were kept in the safest unit. But one of the longer-term staff there told us about a girl who was in her room and rubbed holes into both forearms to commit suicide. He had even taken pictures, which were super raunchy though badly lit. But this girl had rubbed the skin and veins in her arm down to the bone. Obviously she died. Whoa, that's horrific. That's so sad. I was a rec therapist at a state hospital after college. I worked in what was the aggressive male unit. We had all the murders, child molesters, and aggressive males. On the unit there was a wing that was locked at all times for the patients that needed extra supervision. One guy was actually caught committed to this wing. He would take advantage of the weak, so he was on a Q15, which was a visual check every 15 minutes. Once they found him in the bathroom during a check buying pee from another patient for $2. He told the staff that he wanted to gain the power and strength of the other patient. Another guy didn't have an accessi diagnosis, only mild mental retardation, but was aggressive at times and really big, so the state sent him to the hospital because there was nowhere else for him. He would love cookies and snacks, but did not have money. He figured out that if he went to the actual hospital they would bring him cookies, snacks, and Shasta ginger ale. So he began to swallow things to go to the hospital. If not watched closely, he would pull the clock off the wall and swallow the batteries just to get snacks. After I left the hospital, I read a story in the paper about a patient drinking bleach and dying. So I called an old co-worker and they confirmed that the patient swallowed bleach after a janitor left the utility closet door unlocked. I have so many stories about that place. I miss working there. It was hands down the most fun I ever had at a job. All the patients loved me because I was the guy that would hang out with them and take them out of the hospital on field trips. My friend told me this one. She works at the mental hospital in my country that gets the most challenging teenage patients. They got this 12-year-old girl who broke her own thigh bone in her room during the third night. Imagine the willpower with that one. Obviously it became a huge deal because that shouldn't have been able to happen. My grandfather worked at a mental hospital. His favorite story that he used to tell me went something like this. One day I was watching the wards when all of a sudden a huge fellow came running at me. Well, I was scared out of my pants since there was no way I could possibly fight this guy off. Just as he came close and I thought it was the end for me, he kept running right past to the bathroom that was behind me. He always got a good laugh out of that one. People being psychotic and even the violent are things you get used to. the extreme incompetence of a large portion of the staff members, and the awesome job the administration did of ignoring it was absolutely shocking. For the most part it was a mess leading to misdiagnosis, understaffing and mistreatment of patients, but some of them seemed outright malicious. One B of a nurse would constantly escalate situations to the point of restraints and drugs being used in order to get back at patients who insulted her. I feel I should note that there are several who were absolute pros, whose skills I truly admired, but they could only pick up so much slack. Had a patient who often claimed someone stole his amp, guitars and money from his room. He never had any of the sort. He'd single someone out, often another patient or sometimes us nurses, and often start trying to throw punches. He once chased a friend of mine around the nurses' station. We caught one patient smothering another with a pillow. You can't just be like, oh yeah, BT dubs, dude almost died in a horrific way after a funny story about crazy guitar guy. I worked in a locked unit for a few months. I've been bitten, scratched, punched, spit on, had my glasses punched off my face and vaginal fluids and vomit thrown on me. The list goes on. But my worst memories are a toss-up between a guy staring me dead in the eye and slit his wrist with a big plastic pen, or seeing a girl swallow a rubber glove, ice pack, rocks, used tampon, fesses, and an MP3 player. During my several sojourns into inpatient care when I was in my teens and early 20s, there was one male psych nurse assigned to a ward full of female patients between the ages of 16 and 21. You could remain in the youth or juvenile ward until you were 21 because of reasons I don't remember now. Patient problems ranged from depression and anxiety disorders to violent psychosis. Substance abuse was common. It was well known among the patients that you could get cigarettes, alcohol, Adderall, and Vicodin from this one nurse in exchange for sexual favors. He was there for years. He was reported on occasion, but those reports never led to any disciplinary action because, well, who would you believe? The disturbed young ladies with a history of mental illness, behavioral problems, and substance abuse, or the clean-cut well-loved psychiatric employee with a squeaky clean record? That's terrible. Wonder why they don't have cameras or anything in a psych ward all places. Stuff like that could be caught if there was. Oh crap. A question I actually have answers for. All of these are second-hand from when my mom worked the front desk, so take that as you will. One guy got into a straight-up screaming match with his girlfriend, the soda machine. Like, how dare you do this to Emmy? Don't you know how much I've done for you and this family? The whole shebang. One kid, when she worked admissions, came into her office and freaking trashed IT, then broke a red pen, splashed it on himself and on the wall, can confirm the wall splash, saw it firsthand, and tried to start screaming that she was attacking him. My mom is like the sweetest woman you will ever meet, so the techs were having none of this kid's crap. One time, some guy walked in from the street carrying a frozen turkey. Mom saw him sit down in the lobby. He sat there for a solid hour and a half, then got up and left. No clue what was up there. The last one is the only time my mom has ever been creeped out. One evening the cops brought in this teenager, maybe 15 or so. She had ankle cuffs, wrist cuffs, and this weird belt that both sets of cuffs were attached to. They brought her in, and basically stood her in the center of the waiting room. While the cops got her paperwork sorted out, this chick just bored holes into my mom's head with her eyes. Freaked mom out enough to the point that she requested to be let off early to get away from this kid. I'm sure if I asked her, I could get some more if anyone is interested. He was trying to go cold turkey. Former mental patient here. There was an older lady who was so constipated. She was laid on her back in her bed with her feet in the air screaming about birthing babies while they pulled it out of her. Then she'd go about the hall talking about her new baby boy. I can only imagine what would happen if she had diarrhea or something. Poor lady. My dad worked as an orderly nurse at a VA hospital. He said there was a guy who would sit in a chair right outside of his room in the hallway and laugh periodically. One day my dad asks what he's laughing at and the man looked at him and said, "God is telling me jokes." I wonder if God is actually funny or if he's just laughing so God doesn't get pee off. I'm a nursing student who had my psychiatric mental health clinical in a mental health crisis center. In all reality it's not really that crazy. It's mostly Baker Acts for people who are severely depressed, or people who are neglecting themselves due to their mental illness. Mental health units have a lot of negative stigma associated with them being for crazies and whatnot, but really they're just sick people trying to get better. Just like any other hospital. Even the patients with schizophrenia or psychosis are usually there because their meds got out of whack and they are being rebalanced. That being said, the most crazy and heartbreaking case I dealt with was an 8-year-old child who grew up watching his stepdad abuse his mom, but could not do anything about it, so he would internalize his emotions, leading to self-harm and suicidal ideation that culminated in him stabbing himself through the arm with scissors at school when he was being bullied. Hearing about how he wished he could just end his life at such a young age was absolutely heartbreaking and really put into perspective minimal my problems were compared to this kid who had gone through more in 8 years emotionally than I have in 20. One morning, a new admission needed to give a urine sample. During her assessment she seemed relatively aware of things, so nobody thought she'd have difficulty with it. So, I gave her the cup and explained I needed a urine sample. She stared at me blankly. I repeated myself, and when I got no response, I explained I needed to stay in the bathroom to make sure it was a genuine sample. The urine was her own. I turned to give her privacy. The next thing I know, I heard the sink running. She was trying to fill the cup with water. I re-explained exactly what I needed from her. She stared blankly. Mind you, I'm trying to put it as simply as possible at this point. I turned back around to give her privacy. Next thing I know, she's naked and in the shower. I re-explained what I need, and after 15 minutes of this, she complied. I left her in the bathroom and delivered the urine sample to the RN. I was then on assignment of watching a male patient, whose room was next to that particular bathroom. I hear the bathroom door open, but I don't think anything of it. I start to feel uncomfortable, but I can't place why exactly. I happen to turn around to find the female patient from before standing directly behind me, completely naked, staring me down. I avert my eyes and explain she needs to return to the bathroom and put on her clothes. She stares silently, makes an almost unbreakable eye contact with me, and starts rubbing lotion on her breasts. I explain to her again I need her in her bedroom or the bathroom and call for the nurse. The patient goes in her room as the nurse comes over. When the nurse knocks on her door, the patient comes out fully clothed and stated she had no idea what anybody was talking about. Psychotic patients sure are fun. Also, another story I wanted to add would be the time a 12-year-old smuggled in her iPhone 7 Plus by shoving it up her vagina. She was only caught with it because she got her period while storing it. Not an employee, but someone who had to be placed into a unit for about 3 months as a teenager. We had some free time scheduled in for a few hours every day. Most of us were just depressed, suicidal, or had eating disorders. There was one girl who had been abused as a child and she had been there for a couple years. She was freaking odd. One day there was a lot of screaming from the common room and a bunch of orderlies had to pin her down on the floor. She had bitten off her freaking finger and then went all Mike Tyson and bit a chunk off one of the orderlies' ears. I am happy to say that I was moved very shortly after. Yet another reason restraints are humane. So I was on surgery when this happened, but we had a patient who was known to our hospital for sticking light bulbs up his butt when he got stressed. Lots of psych issues obviously. Go figure. He was back because he'd done it again, so I was familiarizing myself with his case and going through old notes. He's probably had 6 or 7 removals at this point, and every single case report, the surgeon documented the type, model of light bulb. I don't know why, but that just amused me beyond belief. 2 people tasting each other's poop and pretending they are on a reality TV show like MasterChef, and one of them is judge who is tasting and the other is participating. This fesses is good but could be enhanced by eating more sodium. A few years back, I was misdiagnosed with bipolar disorder, and when I went to the ER because the meds were making me have suicidal ideation, I was Baker acted. It was the worst 5 days of my life. It was scary and upsetting, and the staff were either really nice or rude, impatient and inattentive. My roommate would masturbate nightly. Other patients would share really disturbing things with me. It smelled awful. The food was awful. My bed was uncomfortable and I had trouble sleeping. A patient choked herself out with a bedsheet. Another patient stabbed herself with a pen, so they took our pens away and I couldn't draw or write. A staff member had her face bashed pretty hard by a tall, large patient and there was a lot of blood. I woke up every morning to screams and it was surreal to realize as I woke you that no, it's not a dream. You're really here. This is really happening to you. In the long run, the most frustrating thing was the cost and the level of care we got. I have really good insurance and work, so it was pretty much covered. But many patients in there had little to no means and were signing forms accepting the charge for care, which was like $1,500 a day. And some seemed to have no idea what they were signing. The care involved basic group therapy and meds. I feel the other patients deserve better. It was an eye-opening and heartbreaking experience. Mental health deserves more attention, better quality and easier, more affordable access. A man who wrapped toilet paper around his legs and set himself on fire. Surprising fact, a lot more mental illness than you would think is caused by a syphilis infection, contracted decades ago. Maybe I should go for an STD check. Worked security at a hospital that required tours through all floors, including the psych wing, not including the numerous responses to emergency codes. Walking by an elderly 65-ish woman's bedroom, she is kneeling on the bed, stark naked, masturbating. Not like you think. This woman is spitting on her fingers and slapping her vagina. Spit THWAP. Spit THWAP. Spit THWAP. Spit THWAP. Okay, everything looks good up here. Call if you need anything. Bye. Not my story, but a story from another local person working in the field. Dude thought he had aliens in his body, so he tore off one of his testicles with his bare hands. Everyone in the facility was vomiting. Nurses, social workers, techs, etc. He must have been nuts. D. My dad is a doctor in a mental hospital, so my dinner table conversations as a kid were these kind of stories. The two that immediately jump out are: schizophrenic woman escapes off of a locked ward. She is missing for a few hours despite being obese. They find her eating a squirrel with her bare hands. Presumably the squirrel was roadkill when she found it because of her weight. She couldn't have caught a live one. Not great, but I always felt bad for the squirrel. Now the real nightmare one. My dad pulled a cockroach out of someone's tongue. Yeah, full-grown cockroach pulled squirming out of this patient's tongue. What I assume happened was patient ate some roach eggs along with something that cut their tongue and the egg hatched inside the tongue. Like they saw something they wanted to eat on a filthy floor and got a handful of eggs. Something sharp, piece of glass drywall nail, along with whatever they ate. A few weeks later when they are admitted, their tongue looks horrible, so my dad investigates and finds a goddamn roach in there. Right after he tells me this story, he tries to convince me to eat the rest of the green beans on my plate. I'll never forget that dinner, and now you won't either. If you'd like more stories from when I volunteered there, I'll be happy to provide some. Another time, I watched a resident eat an entire block of cheese like a Chipotle burrito. He would take huge bites, chew like it was the best meal he'd ever had, peel back some of the plastic, and take another huge bite. I think it was 2 to 3 pounds of cheese in one sitting. I offered to make him a grilled cheese or nachos or something. He was like nah and just kept eating. Army eye roll. Not a worker, but I was institutionalized as a kid. There are few things that have stayed with me. My roommate was getting discharged, and her mom snuck her in a lighter. She tied a string to the lighter and hid it inside her vagina for a few days, because she said she wanted to smoke as soon as she got out. In reality, she would need to go somewhere to get cigarettes anyway. I think it just gave her a good feeling to have something contraband on her after being locked up for so long. Another girl I was in with carved, and I mean carved the word B into the entirety of her forearm. I remember how the scars would catch the light. This particular gal would often receive the booty juice, as they say, a tranquilizer shot to the butt cheek, literally every day in morning group. This one staff member would make a point of saying how disgusting it was to put underwear in the dirty clothes bins in our rooms if they had any blood on them. She said, every single day, that it smelled bad, we were gross, etc. And we were required to notify a staff member if we had leaked on our underwear at all. It might not sound that weird, but she just made such a point of shaming us, and this is an example that stands out in my mind, among others. This lady was incredibly horrible and abusive. Her name was Candice. I remember her well, because during my first skin check, she cornered me in a bathroom, no cameras, and physically ripped my clothes off. I was 14 years old and she was the first person to ever see me naked, and it was against my will. It was incredibly traumatizing. I'm in my 20s now, a senior in college, and I still want to cry when I think about it. What a horrible thing to put mentally ill teenage girls through. I know I wasn't the only one. I left the hospital in considerably worse shape than I was when I came there, and I don't know anyone who has been there who wouldn't say the same. Frick that piece of crap. Hope she got what was coming to her. Not a mental health facility but a nursing home. Elderly people are batshit cray. Love em. I was unlocking a resident's wheelchair to get her back to her room after bingo or crafts or whatever. The other resident, who never spoke, seated at the table is shaking her fist at me with a menacing look in her eye. I continue unlocking the other wheel and notice a massive pile of vomit under the threatening resident. Another resident collected napkins so she could pee on them and distribute them everywhere. Another one would get super irate and screech at me with personal insults for helping her at bingo. Fine, Gertrude, but you don't ever seem to win otherwise. So many of those folks died there without a single visitor. Fine, Gertrude. LOL. My DM has permanent nerve damage in his arm from when a patient attacked him. He also had one guy try to stab him with a needle. No, you take the medicine. I once had a lady tell me she could see the devil behind me standing on the counter. I noped the frick out of that one. He is still behind you. There was a man who ate an orange. They came with his lunch. He would shove the peeling piece up his butt, pull it out and suck on it. He only had one piece of orange peel piece. He did this all day. I couldn't get him to give me the orange peel. This might be the worst experience. NSFL. Diarrhea. Had a patient whose personal hygiene was a 3-4 on a scale of 1-10 most days. His diet wasn't the best either, and so his stools weren't solid. He was also overweight, drank a lot of coffee and smoked a lot of cigarettes. One morning, he got a cup of coffee and went out for his first cigarette of the day. If you don't know, coffee is a laxative and can loosen bowels. That first cigarette on a rainy Oregon day triggered his smoker's cough, and the cough caused him to fire about a quart or more of soggy diarrhea into his blue jeans. How do I know? I stepped out of the office to a very peculiar smell, and saw dime-sized brown splop that looked like chocolate rice pudding. Every 5 or 6 inches, there was a splop, ranging in size from a dime to a 50-cent piece. This disgusting Hansel and Gretel trail led from the back porch, through the dining area, into the living room, up the stairs, down the hall to his room. Just as I come around the corner, this patient, with whom I share a name, so let's call him Crazy Acrollo, is mid-stride between his room and the bathroom, which are directly across the hall from one another. He is mid-stride like Bigfoot in that video, and he freezes in that position, like the guy on the walk sign. If the guy on the walk sign could also remind you of Sasquatch. I say, Crazy Acrollo, what the heck happened? He said, Acrollo, I had an accident. Leave me alone, and he charges into the bathroom and slams the door. I tell him that I'm going to get his soiled clothing into the wash, which I do. I then have to get the mop bucket and bleach solution and mop a freaking trail of diarrhea droplets through 3 community spaces and up a flight of stairs. I have to write an advanced incident report since human waste was involved and constitutes a biohazard for our facility. I should add that my boss and her boss were both lazy pieces of crap who never showed up on time. So I was also trying to prep breakfast and do medication pass for 15 residents within a 2-hour time frame. TLDR. Resident smoker's cough triggers a diarrheal explosion, which he tracks more than 50 yards through a large facility, up a flight of stairs, and into his room. I catch him butt naked in the middle of a crap-stained sprint to the showers. I had a male come into the behavior section of an completely hysterical and trying to get his family to leave him alone by holding a knife to his own throat and threatening to kill himself. While I spoke with him, he cried about the intense pain and how he could not deal with the cat scratch he had given himself. Literally looked like a paperclip scratch. Didn't even break skin. And would never do anything like that again because it hurt so bad. Doc decides to let him go, only to find out he can't leave the hospital because he needs to report to the OB ward where his girlfriend is currently giving birth. One of my most memorable incidents as a med student was when I had to follow the treatment of an inpatient for a couple of weeks. I was assigned this 23-year-old Polynesian girl that had schizophrenia. She had religious delusions and was convinced she was the second coming of Jesus. Fascinating character, and she was really well read when it came to theology. 1 week into my clerking of her, another inpatient came in. He was a 40-year-old Aboriginal man that also thought he was the second coming of Jesus. Initially, these two Jesus had open confrontations and verbal arguments over theology and who was the legitimate Jesus. Both thought the other was clearly a fraud and mental, but neither possessed the insight to recognize that they themselves might be deluded. After an initial week of drama, the fights settled down. The next week, during their outside leave time, both were found having sex in the bushes outside the hospital, surrounded by weed and M. Turns out they had reconciled their differences. They realized that both were carriers of the spirit of Jesus and were going to give birth to the actual Jesus. Over the coming few months, I kept an eye on my patients' records. They got busted having sex a couple more times until a suitable outpatient setting was found for the man. The girl did end up getting pregnant, and I assumed she did have the baby. I didn't check to see whether she did give birth to Jesus. Good, but the comment above about 3 Jesuses beats your story. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.